Welcome to the Pet Loss Companion. I'm Ken Dolan-Del Vecchio, and I'm here with my friend and co-author Nancy Saxton-Lopez, and also a special guest who we'll be introducing in just a couple of minutes. This program is a program that we deliver live on Facebook and YouTube once a week on Thursdays at 6 o'clock for about a half hour. And it is an experience that allows us to expand the information that we delivered in our book, The Pet Loss Companion: Healing Advice from Family Therapists Who Lead Pet Loss Groups, to a broader audience. We've been facilitating pet loss groups for a really long time. Nancy for a really, really long time, 30 plus years, and me for about 12 or 13 years at this point. We like very much to hear from you. And so if you have a story that you'd like to share with us and perhaps share with our audience as well, or if you'd like to give us a recommendation for a topic or a guest, please get in touch with us. You can reach me at kenddv@gmail.com, and you can reach Nancy at nsaxton-lopez, that's NSAXTON LOPEZ at csmpc.com. All this information that I'm sharing in the beginning here is available also in the description that goes along with this program. You can support our work in a number of ways: through Venmo, through PayPal, through a monthly subscription. And again, all that's in the description. This program is a friend of Dakin Humane Society. Dakin is in Springfield, Mass, and you can learn more about all the good things that they do at dakinhumane.org. That's DAKINHUMANE.org. One of the great things they do is they sponsor a cost-free Zoom pet loss support group that I facilitate. It is on the second Tuesday of the month and runs from 6 p.m. to 7:30 p.m. Eastern Time. You will find an RSVP link in the program description, and you can join from anywhere in the world. And I want to stress again that this is free. There's no cost for you to participate. The next one is on the 11th of April, and so that's coming up soon. And also, finally, please consider subscribing to the program on YouTube if you find value in it, because the more people subscribe, the higher the program shows up on the list of resources when people are looking for this kind of support. So if you're not watching on YouTube, there's a link to the program in the description, and then you can go and press the button to subscribe from there. Nancy, want to get us started?
Yes. Dr. McCaffrey, we are so happy that you have joined us tonight. Dr. McCaffrey and I are colleagues. We have worked together. I'm the emotional support and resource person. And Dr. McCaffrey is a well-known veterinarian, but a few years back, and I think I want you to talk about that a little bit, she decided to go into hospice, acupuncture, and end of life euthanasia. And I think that's a very important topic for all of us. We have talked about euthanasia a lot on our podcasts and how difficult that is. And this wonderful woman is doing that for her clients. Her practice is senior pet vet, and she's in northern New Jersey. But Dr. McCaffrey, please tell us how you got involved in this specialty.
Well, first of all, I want to say it's such an honor to be here. So thank you, Ken and Nancy, for having me and for providing this really valuable resource in an accessible way for people that need it. I see it every day. People need this help. So thank you. So yeah, I've been exclusively practicing end-of-life hospice palliative care medicine for about 4 years now. I've been practicing for over 10. It's crazy to say that now. But yeah, so about 5 years ago, I realized there was a gap in the care we were providing as a general practitioner. So from the time of a terminal or life-limiting diagnosis to end of life, it was, kind of like, here's some medicine and call us when it's time. And I felt like, there was a lot more we could do for those patients. But in a busy general practice, you just don't have the time and space for it, aside from maybe some phone calls and things like that. Mm-hmm. So I was actually at a continuing education conference. I saw a lecture on euthanasia, and I was like, wow, I do that very regularly in general practice, but I didn't receive a lot of education on that in veterinary school. It was just something we kind of like learned how to use the medicine, and that was about it. So I went in, and it was the first lecture of the day, and I was like, wow,
Wow.
this is my calling. The whole day I spent in that track, because it wasn't just euthanasia. It was also, palliative, hospice care. This was a new and emerging field. At that time, it was less than like about 5 years old. It's a little over 10 years old now, that field in veterinary medicine. So it's new and emerging, but it was exciting to be a part of that. And so I very quickly made some big changes in my career, and became certified in hospice medicine, and started the practice.
Excellent. So tell us a little bit about what happens when someone calls you. What is the process that you go through with a new client?
Yeah. So the first thing we do is make sure that they're a candidate for my care, right? Because sometimes people just call and maybe their pet has something that's very treatable or curable. So we'll have them fill out some intake paperwork and things like that. Most people reaching out to me, though, are in need of my services. And so, what we talk a lot about in terms of the care I provide is, we're switching from a cure to comfort. And so it's in no way giving up on your pet, but really just taking a different approach. So whether that diagnosis is terminal, like a cancer diagnosis, or just life limiting, severe arthritis, chronic kidney disease can kind of fall into either of those categories, but more often life limiting. And so what can we do to give them the best day each day for as long as possible? That's typically what we do. So they'll call me, we'll set up an intake. I review all of the medical records, oftentimes from several vets. Oftentimes there's specialists involved, as well as their family vet. I work as a part of that team. So I'm a tertiary part of that team. I in no way replace either of those veterinarians, but work to provide, evaluating the in-home environment, and, making sure that there's comfort there. So a lot of pain management, a lot of talk. Yeah.
Pain management, treatment, and also acupuncture, I think you can use with that, correct?
Yeah. So a lot of the patients I see have many of them have exhausted traditional Western therapies. And so the acupuncture is an excellent tool in my toolbox, so to speak, to bring out. And it can make a tremendous difference for certain patients, especially, arthritic, orthopedic, or sometimes neurologic patients. So it's something that we can try, that is tolerated really well, surprisingly, for most people. The dogs and cats will tolerate it well. And so that can help, with pain management as well. And so it's a nice tool to have, for sure.
Dr. McCaffrey, I wonder if you could talk we've heard a little bit about this idea of futile care. I wonder if you could talk about the difference between futile care and what you do with palliative care.
Right. So I think some people hear hospice care and animals, and some people, I get two reactions. They're like, that's amazing. Like, my people, they get it. And then some people are like, you do what? Like, are you going, like, what are you doing? Are we prolonging things too long? Are you just not willing to like say goodbye to your pet? But really that is not at all what we're doing. Again, the key is to provide comfort, and the most amount of comfort. And when we can no longer provide comfort each day, that's when we make a decision, right? And so, I think that it's a misconception, Ken, to be honest with you. And so, but I have the other end of the, pendulum swings the other way too. Some people are, I find, more often afraid to pursue hospice or palliative care because they don't want to give up on their pet. And so, it's like, well, I'll admit that my pet's sick, but I don't want to admit my pet's dying. And so
let me just jump in and ask, do you sometimes have to talk with people about the likelihood that trying to do another procedure or trying another kind of treatment is going to be futile, and it's actually going to increase their suffering rather than diminish it?
Yeah, we talk a lot about that. I mean, the patient personality, like an animal that gets tremendously stressed every time they need to go to the vet, if they need to be receiving weekly treatments, is that worth pursuing? An animal that doesn't tolerate anesthesia well at all, why would we put them through radiation therapy when they need to be anesthetized every day for that? Things like that are certainly discussed. And a common phrase I use is just because you can does not mean you should.
Mm.
That's great.
Right? So we really have to look at the family, their ability to provide care, as well as the pet's ability to tolerate treatment.
So
And
it's a all around kind of, assessment, right? Because you need to know the family, you need to know the environment, you need to know everything about the pet. And I think when we were talking ahead of time, you do mobile, right? You go out. But if this is your own practice in the context of end of life hospice palliative care. But some people, that we have talked to through our podcasts and our emails have used some mobile vets and have had not the best experience. Now that can also happen, I guess, and in a practice also. I mean,
Right.
unfortunately. But what you were saying, which I want you to really talk about, is that it's important to hopefully meet that person,
Right.
because I think what you said, when you do talk about end of life, you spend time with the family and really do quite an assessment, right?
Yeah. And the number one thing they say to me is, I wish I found you sooner. I wish I knew about the care you provide. And I feel like, it could have made such a big difference. And so certainly, regardless of where you are, if you're considering using an in-home provider for the first time for a euthanasia visit, you can consider, perhaps having them come out and do a quality of life assessment before. I do that commonly. Because a lot of times there's a lot of questions around, what is my pet's quality of life right now? Like, I know it's probably close to the time, but I'm just not sure. And I need someone to fully evaluate this case and guide me a little bit. And so those visits, oftentimes when I schedule them, they're between an hour and a half, and I sit in the home and we have an exam on the pet, we review the medical records, and then a really long talk about quality of life for that pet. And some people will then transition that appointment into a euthanasia. Some people will then maybe schedule it, within a short period of time, or some people will enter into a palliative / hospice care program and will provide some alternative treatments. And I've had some of those cases go days, weeks, even over a year. So, getting that opinion, and then you also meet the vet and you can kind of see like how you feel like you vibe with them, so to speak, and make sure that they're the right fit for that final visit, because that's a really significant time. And you really want to have I think the more planning you do ahead of time, the better, not just with the vet that you choose and meeting them ahead of time, but also making plans for aftercare. All of these, maybe any ceremonies or rituals you might want to have at the time of euthanasia. I've had people read beautiful poems and letters, have flowers. I mean, like amazing things, but it's all about doing that planning ahead of time. And I think that planning helps with grief. Once you start doing that planning, it's hard to step into that, but it already starts a little bit of that closure. That you can experience. So I would strongly advise it. Also too, in the moment, it's hard to think. So having everything kind of decided and planned, and knowing the vet that's coming, and that's not a wild card, I think is a wise choice.
If it can be done. I mean, obviously you had this probably as a veterinarian in a regular practice, that the person or the pet parents would bring their animal in, and then it was, well, it needs to happen, right?
Yeah,
or there's even if there's accident or just a collapse of some sort. And then, I mean, you work with them the best you can, but I have to make a decision, right? And they're not necessarily ready to do that. Unfortunately, those things happen. But if you can, we talk about take your pet home and take them and have a life review with them and spend time with them before that actual date, time of euthanasia, like you're saying.
And I think like there are emergencies, right? Situations where the decision has to be made right away. But I think there are also urgent euthanasias that can wait 12 hours.
Good.
and that it's not inhumane. I mean, we don't want to be inhumane, but there are situations where, like, and I think that's a question worth asking if you're ever in that situation. Like, is it possible for me to bring my pet home and have him euthanized at home or her euthanized at home? Like, and again, that's where, just be at any point in your pet's life, being familiar with the services and the providers around you, or even in that moment, doing a quick search for it to see, having that as an option, or even just taking them home for a few hours to be with them and then maybe taking them back to the emergency hospital. But I think that can provide a little bit of time and space for the grief to happen. And it's definitely not for everyone. But another thing that sometimes people will do and don't realize is an option is maybe holding on to their pet's body afterwards for a short period of time. A couple of hours can provide a lot of peace and time to grieve and grieve well. And so even for those, sudden emergent situations, you may not have the time before, but you can have the time after. If that's something you're comfortable with. It's not for everyone, but it is an option that I don't think a lot of people are aware of.
And I think it's good that we're talking about this, right? Because there are other options that will be helpful in the beginning of that grieving.
Yeah.
Well, it's anticipatory grief a lot of times, but at that time of euthanasia.
And Dr. McCaffrey, you mentioned that you do a quality of life assessment, and I believe that you can also do that remotely through Zoom if there isn't a provider with similar qualifications in the person's area.
Yeah, so I can do virtual consults, and telehealth is a little bit different than what we can do in the home because I cannot prescribe medication. But a lot of these visits are just, let's look at the medical records, let's look at the pet, let's talk about what, where you guys are at, look at the home environment. We can do that virtually. I can, see the pet virtually and get an idea of, their overall demeanor and where they're at. So yes, definitely an option for a virtual consultation, just to get an idea of quality of life. It's definitely a much needed resource.
And I think of that as being a way for a person who is, not sure, as we all are, really. We're trying to figure out, like, what's the right time, and is it really time? Is it, and to have an expert give an opinion, even if it's in addition to their regular vet, could probably be very, very helpful to many people.
Yeah, sometimes it is. And I think too, an outside opinion, it's like looking at the whole thing from 10,000 feet, because there's oftentimes, like I said, a lot of doctors involved in the care. And so you have your family doctor, you might have a cardiologist, you might have an oncologist, and then also an ophthalmologist. I mean, there can be so many moving parts, plus doctors that are doing the imaging. And so to take it all at once and look at it, and then look at it in the context of quality of life specifically, is valuable and can provide additional insight for sure.
Because quality of life, that the scales are helpful, but they're not necessarily exact, right? So you have to make your decisions in that format of, well, he's a 5, he's supposed to be a 10, or is he in pain, or is he having better days than not? Because with elderly dogs, they sleep a lot. So is that an indicator of not a good day? So it is better, I think, to talk to, or would be helpful to talk to a professional. Because
and one trick for quality of life that I'd love to share, if I may, is like you talked about, Nancy, like, today's a 5. Does that mean he's suffering? Well, I think you have to look at it again from like a 10,000 feet kind of level. And that's where journaling your pet's quality of life every day, giving them, like, either, depending on how detail oriented you are, like a plus or minus for good day, bad day, or even ranking each day on a scale of 1 to 10. Quality of life is so subjective. And by creating this data, you're making it more objective for yourself. You can look at how they were 3 Tuesdays ago, because quite frankly, who remembers that, right? But if you're writing it down, you'll know. And oftentimes you can see trends. And I think that becomes very helpful. It's something I encourage all of my palliative hospice care patients to do. just to get a little bit more of an objective look at things, you know.
That's very cool.
Can you share some thoughts on involving children in the decision making and in the experience?
Yeah, I'm totally open to that. I think, you know, when I first started practicing, I was incredibly uncomfortable with that idea.
Mhm.
But as a mom and also as a hospice veterinarian who has had children attend in beautiful ways, I'm totally for it. I think first and foremost, it should be the parents' decision to even offer the opportunity, right? We know our kids best as parents. And then I think it's good oftentimes to give the child the choice, right? So you can say, you know, talk to them depending on their age, knowing A, are they emotionally capable of handling it? And then B, you know, do they want to be there? And giving them that option. And then also definitely having a vet that's going to be comfortable with that. Because again, you know, I mean, that's a very, very delicate moment. And you really want it to be handled as perfectly as possible, especially if children are going to be there. But I think it can be, you know, our dogs teach our kids, you know, love, responsibility, companionship, and they can teach us about death well too. My own daughter attended my pet's euthanasia when she was about 4.5 years old, and she was like magnificent. I was so proud of her. You know, she, you know, but also too, the other thing I'll mention to parents is like, think about how you're going to be in that moment too.
Yeah.
Because sometimes seeing a parent really, really upset,
Yeah.
be upset or upset
Frightening.
for the kid,
It'll be frightening.
or, you know, for the child of any age, than the euthanasia itself. And so, you know, that's another thing to keep in mind too. If you really want to be able to just not worry about that, and you know you're going to be very upset, you know, maybe consider not having them there. But I think more kids can be there.
Yeah, they're more resilient than we think.
Yeah.
Right.
And I kind of feel too, like if you're going to get really upset, so be it. I
Yeah.
mean, within limits, like you don't want to be falling on the
Right.
floor, pounding your fist.
Right.
But because everything that we do as parents provides a role model for our kids and teaches them that this is how we feel and this is how we manage how we feel.
And
When
it's
these
okay
kinds
that
of
we
very
feel
sad
this way.
things happen.
Right.
Yeah.
Absolutely. It's okay to cry and to see mom and dad cry because they love, you know, this pet too. And it's okay for you to cry, you know, absolutely. I think again, they teach us so many things, and I think it's a bittersweet, beautiful thing they can teach our children at the end too. Yeah.
So when you go into euthanasia, what the actual, you know, performing of that, how do people react? What are their questions and how do you explain it? Because obviously they're nervous, they're anxious, they're sad, they're, you know, they're emotional.
Yeah. So I think what's nice about in-home euthanasia is people have a lot of time. Like I mean, these types of appointments are not emergencies. Sometimes they're same day, but they usually have some time to prepare with the pet alone before I get there. So I find most of the time when I'm there, people are ready. They've been watching the clock. They know that I'm coming. So we'll settle in. I'll get to know them. I'll greet the pet. I'll greet the family. We'll settle in the home. A lot of times we've had conversations ahead of time discussing the procedure, any questions they might have, that sort of thing, ahead of time. But I will always ask, like, do you have any questions about what we're about to do, what the procedure looks like? And then I will still, regardless of questions, give a quick, brief summary of what it's going to look like. It's a 2-step procedure, you know, that sort of thing. We'll give sedation first and then, you know, give the final injection. You know, so we'll just talk about that. And then when they're ready, we'll start the procedure from there.
And there's something like there could be, I mean, a reaction, I guess. I mean, and that's something that I know that you would probably say, you know, probably won't be, but there could be, and this might, you know, so that they're prepared in case.
So yeah, and I don't like to list a list of everything that could possibly go wrong before I do the procedure. Because, but what I will do certainly is if I see things happening, I will explain to people as it's happening. This is just, you know, this
Normal.
sometimes their muscles twitch a little bit when the sedation kicks in. So we'll just say, this is normal. This is just the anesthetic drug from the sedation. Sometimes the muscles get a little twitchy, very normal, you know, just so people don't think or worry that, something is out of control or is happening that shouldn't be, that sort of thing. My big thing is giving the sedation injection. That's the big warning I give is, we'll give treats and scratch behind the ears and try and distract pets from that injection as much as possible. And in my dream world, and I try to do it as often as possible, they don't notice it going in, but sometimes they react, right? So I'll always say this is the only part of the whole procedure they'll feel. And we do everything we can for them to not even notice it, but sometimes they'll react just like they're getting a vaccine or a medicine injection.
And so as it goes along, you're there talking to them, talking to the pet parents, talking to the animal, and
Yeah, and it depends. Like some people are chatters. I mean, I'm a talker, as you can tell, but some people want quiet. And so you have to feel the room. I think, some people have music playing. I think that's beautiful. I think it's beautiful to have a little bit of music. Some people will light a fire, even in the summer, because it creates a nice mood, or light candles. So it depends. And some people want to laugh. It sounds crazy, but some people want to laugh and tell stories and joke, and it lightens the moment. That's what they want to do. And so I will kind of follow that lead. Some people are really solemn and quiet, and I can follow that lead as well. So we'll sometimes have some gentle conversation, sometimes some jovial conversation, sometimes just silence. Just depends on the family.
It depends on the family. It depends on the person.
Well, to me, it demonstrates how important it is for you as the practitioner to be sensitive and to be really empathic to what they're feeling. How crucial that is.
Yeah. And it is very important. I mean, how do you take care of yourself? I mean, this is something that, this is not the easiest of things to do. Obviously you want, especially in the hospice area, the palliative area and acupuncture, I mean, you're helping that pet not be in pain, right? But when it comes to that time, obviously this is also what you do. So how do you take care of yourself with this?
It's funny. It's literally asked at almost every euthanasia appointment, like, how do you do this? And, there's a lot of levels of that for me. I mean, one, this is not just a professional calling, but for me, it's a spiritual calling. I truly, I'm a believer in God, and I feel like he called me to this work, to minister to families that are grieving. And so that immediately lightens the burden, because I feel like I'm operating in what I've been designed to do. Also, as crazy as it sounds, like this is work that is so valued and appreciated.
Yeah.
I can't tell you the number of cards that I receive, pictures of pets in their prime enclosed in it, and words of just such gratitude, thanking me for being there when they needed me. And so it's hard, it's heavy. There are times I get in the car and cry, absolutely. But I'm not doing something that I'm doing something that needs to be done. I'm helping a pet, and the way I explain it to children when they're present, and my own daughter too, is like, this pet's going to pass away, and we're just helping them. We're making it easier for them. So I'm giving these pets a good death, which is what these wonderful babies deserve. And so as heavy as it is and as sad as it is, I mean, there's like that spiritual component for me, but also it's really rewarding work, to give pets a good ending.
The best ending they can get with their family.
Yeah.
Right.
Yeah.
And it's not that, we would say, Kat and I in the group all the time, you're not killing your animal, the diseases.
And you're ending their suffering.
Helping them.
Easing their suffering.
And like one analogy I use is like a path, right? And this is what was taught to me in my hospice training. I love it. Like there's two paths, right? The end is this lake that we're walking to, right? And one path is a straight, clear, predictable path, and that's the path of euthanasia. And the other one is this like windy up and down. We don't know how long it's going to take. We don't know what obstacles are in the way. That's kind of the path prior to euthanasia, but also more towards the natural death component. And so, knowing that you're taking that, you want your pet to have that easy walk to the lake, I think most of the time.
That's a good way to put it.
Yeah.
Yeah. So we are just about out of time. So we want to thank Dr. McCaffrey so much for being with us and let you know that you can learn more about her at seniorpetvet.com. And that information is in our description. Also, just want to remind you, if this is helpful for you, this program, please do consider pressing the subscribe button on YouTube so that it can become more readily known to others as well. So thank you so much, Dr.
Thank you,
McCaffrey.
Dr.
Really
McCaffrey.
appreciate
It's
it.
been wonderful.
Thank you so much for having me. I really appreciate you having me on here, guys.